for this podcast, Sasha and I are just going to reflect on what we learnt about dressing interventions from our paediatric placements. So what I learnt from my placement about dressing was that dressing, like, it is an important occupation across all parts of someone's life, but especially in early childhood. And many OTs work with children and also the parents as well to help with gaining independence with dressing skills. And it's really important in this field of OT to be really family-centred in goal setting and really working with the parents, because it's also, you have to consider their routines and their own roles as well as the child's as well. So even when you're thinking about like developing resources, making it something that they can already use in the home and it's not going to add extra time or extra pressure into their already busy routines. So what we would do in the clinic for things like shoelaces and putting on, like donning and doffing pants and shirts, we would create a lot of visual schedules. So really outlining the expectations of what the child needs to be doing, having a set of instructions. It was really helpful for children, especially who have some behavioural problems and ASD, who really they really thrive off having set explicit instructions and routines to help them stay regulated because they know what to expect. So just having, creating that with them in the clinic, and then even personalising it, so adding things that they really enjoy, like colourful pictures or taking photos of their actual personal clothing items and using that as well, just to create a sense of, just to help strengthen the connection of what they're actually doing. I felt like that was really helpful. And then using that in the clinic and making copies of that so that they could use that in the home environment as well. Just so that, you're not making them go out and buy extra resources, and it's less time consuming for them to use that in the home. And then in the actual therapy sessions, just bringing along a pair of shoes, bringing along like a pair of clothes, something that they will actually need to be using at home, and just working on that gradually in the session. So it really helped when the therapist would also sit there and mirror what the child was doing, just to have that visual guidance for them as well. And then, we also used a lot of social stories as well. So that's very similar to visual schedules, but that's more of, it's just a little book, and it can be a little bit more explicit, and that can also allow for some more like behavior regulation stuff to be added in as well. So saying, if I need help, if I'm getting frustrated with putting on my shoelaces, tying my shoelaces, I can ask for help. So just having a lot of those little cues in there was really helpful.
Yeah, I think my placement experience was similar to yours, Bronte. At the private practice where I had my placement, we worked on building dressing skills with a lot of the kids we worked with, of all different ages and abilities. And we targeted dressing skills in two different ways. So we would either target it through play, so maybe dressing up, which is like more explicitly like using those dressing skills, or even just games. Say they were working on their buttoning skills, we would work on games that targeted like in-hand manipulation and other fine motor skills that would translate to the skill of buttoning. But I think the most effective way of learning to dress and teaching children to learn how to dress is to actually do it and to get dressed. So like Bronte said, having like bringing your shoes along to the session and practicing tying your shoelaces at the end. Or I know one of the girls that we worked on like learning to get dressed independently, it was one of her primary goals. Every session at the start we had a little bag of clothes. She picked out what she wanted to wear for that OT session, and we'd put them on, and like just watching, I guess that repetition of practicing putting on her shorts, like putting them on the right way, and then practicing buttoning up her little button-down shirt, that repetition really worked for her. And I think another important thing to go along with that is the importance of verbal prompting. So Bronte talked about visual prompting and having like a visual there, but using the right words with kids in teaching them how to put their clothes on or how to tie their shoelaces is so important, because they don't know how to do it. So if you just say, put your shirt on, like, there's so much room for error there. So having like clear, concise verbal prompts, and combining that with physical and visual prompts, I think is a really effective way of providing dressing interventions with little ones. That'd be probably my biggest takeaway from dressing interventions on my placement.